Small but vulnerable carotid plaques are a more important cause of stroke than previously thought. Results from the Carotid Plaque Imaging in Acute Stroke study show patients with complicated carotid plaques detected by high-resolution magnetoresonance imaging are at increased risk of recurrent ischemic stroke or transient ischemic attack (TIA). Visualization of carotid plaques can identify patients at high risk of developing cryptogenic stroke. The risk is usually high in patients with a ruptured fibrous cap, intraplaque hemorrhage, or mural thrombus in carotid plaques. Among patients with cryptogenic stroke, patients with ipsilateral complicated carotid plaques have a 5.6-fold increased risk of recurrent ischemic stroke or TIA compared with patients without such plaques. Compared to older patients who are more likely to have a stroke due to undiagnosed atrial fibrillation, these patients have a greater burden of risk factors such as smoking, diabetes, or high cholesterol, which often lead to the development of vulnerable plaques. It follows that, on the one hand, in patients with atherosclerosis of the carotid arteries, it's necessary to control the condition of the plaques, and, on the other hand, to take intensive measures to prevent their damage. Among these measures are healthy lifestyle, drug control of cholesterol metabolism, primarily with the use of statins, and systematic anti-inflammatory therapy, primarily through the use of aspirin in small doses. If these measures are not enough, the possibility of intravascular interventions on the carotid arteries should be considered. Who is armed is protected. Take care of yourself and be healthy.